switch on off the mute, and then or if you feel more comfortable, please go ahead and put it in the chat box. If I don't see it immediately, we'll definitely get to that towards the end of our webinar this afternoon or morning, depending on where you're from. But yes, please feel free to ask questions. This is what the webinar is all about. So I've got my model ready on the bed, and we're going to go straight into the cupping, and I'm going to cover some information of cupping as we then cover the practical part of it as well. But as I said, please feel free to ask any questions. That's what we're all here about. So I'm just going to switch the video angle here for us so that you could see my lovely model. And today we're going to be the back. And if there is any other areas that you do want us to still cover, please feel free to reach out to me and say, you know, which area you'd like to do for our next video. All right, so I'm going to go ahead and just quickly talk about the various cups. So this over here is our body cup, and then we've also got our super cup, which is slightly larger. Now, the body cup is available in a soft and a hard strength cup. Soft cup is basically what you start your treatment with, right? So introduction, heating up the muscle tissue, and it's also great to use all over the body. Your hard cup, you're definitely going to work a little bit deeper, thinking more towards like sports massage, etc. Your super cup over here is available in a soft strength as well as a medium strength. Now, the medium strength covers the gap between the soft and the hard body cup. And of course, the soft cup is a soft cup, right? Now, the difference is sometimes it does feel like it works a little deeper. That's only because it covers a larger area at the same time. Because it is larger, fantastic for bigger areas like the back, for example, stomach, thighs, etc. All right, so I am going to give you some guidance as to which cup we're going to use for which section. But of course, it is dependable on the client that is lying in front of you. What are you treating? How deep do you want to work? And what the preference is. All right, so first off, we're going to start with 3 hand movements that I'm going to be showing you. And the first hand movement is what we call the L shape. So my hand is going to be in an L shape over here, and my other hand is going to be doing the cupping work. So squeeze the cup in the air, then place it down, and I work with my L shape. So my right hand in this case is just going to hold the cup. It's going to give extra support. And then I'm going to lift the cup slightly at the bottom there, but we'll get to that particular movement. Then your next hand movement is your triangle. So squeeze my cup in the air, place it on my client, and I have my hands in a triangle. So just for camera, to see it a little bit nicer, this would be the triangle movement. Okay. And so then you'll move with the cup, pushing away any excess tissue that's in the way, and you'll work with your cup. Last but certainly not least is your U shape or goal post. And that's literally where I squeeze my cup in the air, place it down, and have my hands open. And so I'm just going to come around just so that you could see that movement there. All right. So those are the 3 movements. And so, of course, once you start the cupping massage, you're going to go ahead and, which I've already done with our clients on the bed, place your oil, your complex, which we spoke about during our last webinar. And you'll do that with just hand effleurage on the client. You'll start your massage with a little bit of kneading, and you'll do kneading all over. I'm just doing a very quick demo of the kneading because that's not really what we're focused on today. All right, and then we're going to go straight into our cupping movements, right? So the first movement, I'm going to use my soft cup, and I'm going to squeeze it, place it down. I'm going to use my triangle, but you could definitely also use your L shape. And so I'm just going to do a cup effleurage, go down and come all the way back up. And go as far as you can possibly go into the neck area. Okay, so we want to make sure that we always keep the cup moving to avoid a cup kiss. I'm just going to demo an L shape as well. So to avoid a cup kiss, and just what is a cup kiss? It just shows you where stagnation has been moved from a deeper layer to a more superficial layer, allowing for fresh, oxygenated, rich blood to the underlying area. Right, so that was the exact same move, just one with the triangle and one with the L shape. Our second move is going to be where I divide the back into 3 sections. Upper back, middle back, lower back. All right, so what I'm going to do now is I'm going to do circles. So squeeze my cup, place it in the air. For this particular movement, I also like the body cup. But again, it does depend on your client. I'm just going to do 3 circles on the upper back, just on the right side. Well, my right, my client's left. And we're going to do 3 circles on the client's mid back. It's important because cupping can be quite, once you get the hang of it, it's actually quite easy. And it's important that we remember to do it in a nice, slow, relaxing technique. Generally, when we are massaging, there's relaxing music playing in the background, and that will give you a certain tempo to massage with. And then you'll simply switch over to the other side of the back, and you'll perform your 3 circles on that side. So from that movement, I'm going to go ahead into my spinal clearage movement. Now, what I love about cupping is the fact that you can actually work directly over the spine, because we are working with negative pressure. So cupping has been around for ages. We've simplified it and modified it to be easier to use. And for this movement, I am going to use my super cup. I'm going to squeeze my cup, place it on the area that I'm going to start working, and I'm using my U shape or my goalpost, and I'm simply going down the spine, and I can actually use a little bit of pressure on my erector spinae muscle. Once I get to the lower back, I'm going to use my 4 fingers, just grab the cup and then come back again. So as I'm speaking a bit today in between the movements, I'm going to lift the cup so that I don't necessarily give my client a cup kiss, although she doesn't mind. You don't need to lift it. You can go from one movement into the next if you prefer. So the spinal clearage, you can do 4 to 6 times. And then we also need to talk about contraindications to cupping. We want to make sure that we do a phenomenal treatment for a client and that they're not contraindicated to it. So just a couple of things, of course, is if a client is using blood thinning medication, if they have or prone to blood clots or thrombosis, it's just to ensure that we are using safe cupping methods. So those types of clients, we will not do the treatment. If a client has diabetes, we will not do the treatment. If they have cancer, we have 5 years remission. Sorry, I was just lifting my cup. I saw someone was joining our training. 5 years remission for cancer clients. If a client has herniated organs, slipped discs, bruises, cuts, abrasions, sunburn, those are all things that you can avoid a particular area. Even varicose veins, if you can avoid that particular area, you can still perform the treatment, but avoiding the area. Uncontrolled high blood pressure. If there's anything else that you are thinking of now that I might not have mentioned, please feel free to ask. It's such a versatile treatment that really, as long as the client is not contraindicated to it, it's really something that we want to make sure we upgrade or advise each client to do, as it just enhances the benefits of massage and gives you such a fantastic treatment. One of the things that I probably hear the most is once a client gets off the bed, they'll definitely say something along the lines of, I feel so much looser. And that's because we loosen the connective tissue by pulling away, by using that negative pressure. Okay. All right. So our next movement from there, I'm actually just going to step to the side of my bed or table and do that. And this is going to be a draining movement, or what we call taking out the trash. Now I'm going to use my body cup again, and I'm going to start as low as I can possibly go, squeeze my cup, place it down, and glide from the midline outside. Once I get to the side, I'm going to squeeze my cup again and slide out. That way there's no noises as I perform this treatment. My hand will keep in touch with my client and glide back up again, squeeze my cup, place down, and move again. Now, as soon as there's space, what I am going to do is I'm actually going to use both hands. so that there's 2 hands gliding, which makes it a U-shaped movement again. Make sure that each pathway overlaps with each other so that we ensure that we do a thorough drainage or a thorough taking out of the trash. If you've just joined our training, I'm just going to ask that you do mute yourself. You can unmute if you do have a question. It's just to ensure that there's not a lot of noise and someone might be missing out on some of the information that we are sharing. Now, with taking out of the trash, you want to ensure, and you can actually see that I'm going directly over the bony areas, the scapula, but you do want to ensure as you get to the neck that you include, and I'm just going to remove my hand so that you can see, but they actually go into the neck area as far as you possibly can to give the client the best possible results.
Mm.
Is there anyone that does have a question at this point? Okay, then I am going to continue on with our treatment. Now, of course, I'm only doing one side or showing you one side today because we are trying to keep the webinar effective. And of course, the camera will see that side much better than the other side. But once you've done the one side, you would repeat on the opposite side. Okay, so from here, we're actually going to stay on this side, and I'm going to treat the erector spinae muscle by doing 3 different movements. First up is your vibration, your fish bite, and then you've got the boat movement. Each of them, I'm going to use an L shape, and I'm going to go from the lower back to my upper back with one hand. I find that if you are right-handed, it's best to stand on the client's right side. If you are left-handed, it's best to stand on the other side. And you can also do it from the top, whichever you are most comfortable with. All right. And as you'll see, we also use one hand cupping and the other hand for support. And that's the way that you've got the most control over your cups. So the first movement, as I mentioned, is vibrations. And exactly as it is, my right hand is going to do the vibration movement. And my left hand is simply going to go and slide up towards the neck area. It's important that the left hand, in my case, is supporting my client and not also jostling or vibrating, right? It just makes it so much more comfortable for the client. And this really helps to loosen that connective tissue and muscles. And you'll do this 3 times on each side of the spine. Then I'm going to go into the next one, which is called fish bites. Now, fish bites you can do in 2 different ways. In your treatment, you won't necessarily do both ways. You choose one of them. The first one is going to be with your L shape. And you're just going to squeeze and release the cup as you move along the spine. So again, you're working on the erector spinae muscle right next to the spine. Just show you on that side. And I always say when I do the training that remember, this is not a hungry fish, it's a lazy fish. So the movement or the squeeze is a nice, slow and relaxing movement. I said earlier, we have to remember that we need to do a slow movement. It's definitely for the client's relaxation, but also for the results that you will give your client. So the second way that you could do a fish bite is by actually using your super cup, and you're going to use both hands then. Ensure that the hand is touching your client. And I'm going to take my super cup and I'm going to squeeze and release as I move towards the upper back or towards the neck. Definitely great for men as we are using the super cup, and a lot of times the men prefer that. And so again, you'll go as far into the neck area. I'm just going to remove my one hand so that you could see as you could possibly go. And I'm going to do another one. Whilst I do this one, so if you are struggling with the cups, whether it is just keeping suction, etc., there's 3 things or troubleshoots that you could go through. Number 1 is, do I have enough oil on my client? So you'll use a little bit more oil than you would use on a regular client, but just to give you an idea, it's about 25 mils with the balm, as we have just, recently launched our balm, so it's about 25 mil of the balm. But if you feel that maybe it could be, if the client's a little bit extra dry or a little bit larger, you're more than welcome to use a little bit more. And 25 mil, sorry, just to correct myself there, that's not for the back alone, that's for a body treatment. Yeah. So the second thing that you'll look at there is, am I moving too fast? So you'll need to slow down then. I'm only lifting my hand there towards the end, and that's simply for the camera to see better. The third and last thing then is, do I have too much tissue inside my cup? Then you'll just lift your cup slightly, release a little bit, and feel like, okay, I have more control. I'm moving a little bit easier with my cup. Right, another thing then, just in terms of the cups themselves, they're made of medical grade silicone. And so after every single use, you need to wash your cups with a liquid disinfectant soap. There's various types, but any liquid disinfectant soap is perfect. We also do offer a soap at Bellabaci. And then your next movement here is then your boat movement. And this is literally where you're going to take your cup, and again, I'm using this one that is the body cup, and you're just twisting the cup as you move to the upper neck area. Okay, if you find that the cup is too pliable and you're just really struggling to control it, just put it in a little bit of cold water or even in the fridge, and that will help it to strengthen a little bit again. Please don't take it from the fridge onto a client. You will then leave it to just go back to room temperature before you use it on a client. If the cup is really hard, it generally happens if there's air blowing on it, or if it's really cold, it could possibly happen. Then what you could just put it in a little bit of warm water, and that will then help for the cups to become more pliable and easier to use. Absolutely no need for sterilizing units, anything like that. It's not necessary. The silicone, the medical grade silicone, is basically self-sanitizing. What we need to do is wash the oil off. That's why you wash it with any type of liquid disinfectant soap, and that's with lukewarm water. That just makes it easier. All right. And then from there, of course, you'll repeat on the other side of your client, and we'll go to the neck area. And now for the next movement, it really is, I really find in this case best to depend on your client, what type of massage you're giving. You can do either the super cup or the body cup. For my client, I'm just going to go ahead and use the body cup, and we're going to do a figure of 8 or an infinity sign, again by dividing the back into 3 sections. I'm going to use my upper back, my middle back, and my lower back. Okay, so what I'm going to do, I'm going to go ahead and do my figure of 8. First on the upper back. I'll go to my middle back. And then I'm going to do on the lower back. As you do the massage, you'll definitely feel, as the blood circulation increases, you could feel the heat in the client. You might even notice some pinkishness on the skin. I'm going to switch my cups, and I'm going to use my super cup, and we're going to do a cervical circle. Cervical circle, of course, you're going to work on the cervical spine. Lots of times for a client, you'll experience, or you'll see that they've got a little bit of a bump or a hump there. As we know, it's called the divergence hump. And you're just going to work on that. So basically just between the scapulas and above, there's no other place that you need to go for that. And I'm using my triangle movement for this. And we're also going to do 4 to 6 circles on this area. Okay, before I move on to the last few movements, is there any questions regarding the cups or anything that I've done so far? Okay, so I'm going to go ahead and continue. Our next movement is then called your 3 smiles. So I'm going to work around my scapula, around the neck, and on the other scapula, and that's my 3 smiles. Squeeze in the air, place down. I'm using a triangle movement, and I'm using my body cup. And I'm simply going to go as far down the side I can, and then back into the neck as far as I can. So prior to a cupping massage, just a couple of things to avoid is an aggressive exfoliation, generally salt scrubs. No sauna or steam rooms unless there's about a 5-minute wait between. No exercise directly before the treatment. Also, a couple of things that we're going to be cautioned with is a client that has low blood pressure. We want to make sure that the client can relax. Any client that's is younger or older. And we're going to use lighter suction on the kidney area, which of course is your lower back. And we also don't work directly over major veins and arteries. Post-treatment, we want to ensure no saunas and steam rooms, no exercise directly, although I have to be honest, I've not met anyone that had a cupping massage and then thought, oh, a run is a great idea. They all just want to relax afterwards and enjoy the benefits of the treatment. Yeah, and if the client, especially for those of you joining from areas that really go super cold, snow, etc., you want to make sure, because we've increased the blood circulation, the client might feel a little warmer. So we want to make sure that if they came in wearing a jacket or a coat or a jersey, they leave the spa, because we don't want to have them have a stiffness feeling when they walk out of the spa or the salon as they've had their treatment. Okay, so what I'm going to do now is I'm just going to slightly move the camera because we are going to be working on the neck a little bit more. Let me just see that you can. So if you do have any questions while I do the shift, you're more than welcome to ask. Okay. Yeah, so that's basically your post-treatment care. So now I'm going to be working on the neck area, and we're physically going to work on this area here. This is where we want to target. And so first we're going to do is what we call a neck slide. Now for the neck, I definitely would advise the body cup. I really do think the super cup won't really work well in this area, but you're welcome to try it. It's just, of course, this is an area that's a little bit thinner to work on, and that's perfect for the body cup then. So first one is slides, and what I do find just a little tip from my side is if you squeeze the cup, whenever you work on the body, we want to make sure that we squeeze the cup in the middle. That way you've got the most control over how deep really you are working, how much tissue you're pulling up in the cup. But on the neck slides itself, I do find if you squeeze a little bit lower, especially if your client is quite tiny, if you squeeze a little bit lower, your cup is a little bit flatter and it just works a little bit easier. But also you don't want to squeeze too flat and have zero suction in the cup, because then you're not really doing cupping therapy. Okay, so I'm just going to squeeze from the shoulder there, and I'm going to use one hand just to quickly show you, and I'm going to glide into the neck as far as I can possibly glide into that area. And you can actually use the thumb of your other hand to lift any hair or anything that might be in the way as you move. For the second one, I'm not going to use a hand, just so that you could see it in the camera. There we go. And as you can, move into the neck as far as you possibly can. Okay. Just want to move it slightly more. Right, so just to show you once more. Go into this area and as far as you can possibly take it into the neck. Okay, so that's your neck slides. And then you'll do on the other side. In this case, I've changed my hands over, slide, as far as I can possibly go into the neck area. Then what we're going to do is neck circles. So what I'm going to do is I'm actually going to control the cup between my hands here as far as I possibly can. But my right hand is going to do some of the work, is going to control the cup, just so that the cup doesn't fall off my client and fall on the floor, etc. So it gives you extra control, extra movement. Okay, so squeeze my cup in the air, place it down, and that's the type of movement that you're going to do on that area. Although, again, like I said, your other hand is there for support. And whenever you're doing cupping, it's really safe and effective, but you want to make sure that as much as you can, you've got hands on your client, because that feels really nice for the client in combination with the cups. I think sometimes a lot of clients are confused and they think that we just place the cup and then move on. But when we do the movement cupping, because that's what we specialize in with Bellabaci, it feels absolutely amazing for your client, the combination of the two. There we go. And then you'll simply use a little bit of a triangle movement. Let me just move my hand slightly to get to the other side. And then you'll just swap over and do the neck circles on the other side. You can also then perform some knuckling. And you'll finish off with a hand effleurage for your client. And that is basically your cupping demonstration on the back. If I'm not mistaken, I've had quite a bit of requests for our next cupping demonstration. If you want to rejoin it, that one will be more focused on the legs. We've got quite a couple of clients that have asked if we could do our next webinar on the legs. So that's where the next one will be. If you are joining us for that. I just want to quickly heads up and check if there is any questions on our Facebook, as we're also sharing that on the Facebook Live. Don't see any questions there either. Perfect. All right. And so that is our webinar for today, focused on our massaging our clients, on the back cupping. Please feel free if you have any questions. Now would be the time to ask them. Or, of course, you're welcome to contact us afterwards if you think of something. Is there any questions before we finish off with our webinar for today? Let me just see here in the chat box. Tanya, did you want to ask something? I'm hearing something, but I'm not hearing clearly. Is it not you? Amy, you were asking, how can you obtain more training material on cupping? Is there anything specific that you wanted to know more about? Maybe it's something that I can mention on here as we go through it now. Otherwise, you're welcome to contact us at info@bellabaci.com. I'm also happy to share, and maybe I'll just do that in the chat box. I'll just share my direct email information as well, as I am the training for the international. So you're welcome to just go ahead and contact me. It's yurisma@bellabaci.com. But of course, my name is a hard spelling. Please go ahead and look at our Facebook page as well for our next dates that we have. We'll have one every each month. And then, of course, every third month we'll be back to. So basically, someone just asked, when is the leg one going to be? What do we know? March? June. So June would be the next one. I think it's the 6th of June, if I'm not mistaken. But please go have a look on our Facebook page. I will repost all of the dates there, so that if you did want to join that, you're welcome to do so. Our next webinar for next month will actually be on our sports range. So if you haven't seen that range yet, or you don't know about that, that's the perfect time to join us to learn more about it. Yeah, absolutely. I will, please contact me directly if you do want to have the recording of this training. I will share that with you as well. That you can reshare that with your team as well if you'd like to do that. So Bellabaci is the original creators of the silicone cups. And as that's the training that we focus on, I would definitely recommend, if you are wanting to purchase cups, the Bellabaci cups is the ones to go for. They made a medical grade silicone, which makes them excellent. They're the originators in the silicone cups. And of course, if you have any questions, you're welcome to contact us for any more information on them specifically. I think I've answered all of the questions that I've seen in the chat box. Kathleen, you're welcome to again, just contact me and I'll send that to you. I'll also upload this video onto our YouTube channel if you want to go watch it there. And again, it is on our Facebook page as well. Perfect. Thank you so much for joining, everyone. I look forward to seeing you on our next webinar as well, where we'll talk about our SOS sports range. If you've not heard about it, please do join there. Thanks so much. Have a wonderful day.